Hello, it's December 10th, 2020, and we're coming to the end of fall officially. We're about to get to that solstice where winter really starts. And so we're really looking forward to the new year. We're looking forward to the spring. We're looking forward to seeing everybody back on campus, and we'll be talking about that some today. At our early planning phase, we'll be sharing where we're at. There's some questions still out there, and we'll acknowledge that as well. But we also want to take a moment, since we're coming to the end of fall, to look back and to celebrate the success of the Wagner community. It's been remarkable what has been done here at Wagner this semester, and we want to take a moment and acknowledge that. It took everyone's efforts. And, we're in that rare set of colleges that plan to reopen for in-person as well as virtual learning. And we sustained the entire semester successfully on our campus with classes occurring up to the last minute and performances the final weekend before we send everybody home for Thanksgiving. So it's been a remarkable semester. There's a lot of things I want to talk about today. We can't list everything, but I want to acknowledge a few things that did go really well. A lot of campuses are not able to say this. We are, thanks to everyone's contributions. Our classrooms, of course, were outfitted for remote instruction. Our library was open for patrons, one of the few libraries in New York that was open for patrons. Campus dining was open with a new mobile app that proved to be very popular. Live theater and dance performances happened. The marching band performed, our sports teams practiced. And so there's so many things. I can't list all of them, but there are really some really wonderful achievements that enabled our community to come together. And it's a learning community, a growing community, developmental opportunity for our students. It was great. So we got to give ourselves a little recognition on that. We tend to be humble here at Wagner, but we should be proud of our achievement. And I'm really glad that I'm joined by many of the team members who made all that happen today. We will want to talk a little bit about our experience with the pandemic, which is ongoing and very serious. And we take it very seriously. And we had planned unbelievably carefully for this, and we worked very hard to get ready for this. It took many months of preparation and just an enormous amount of work from many people. It all came together with great success so that we were able to mitigate the spread of the virus and to make significant contributions to public health, as well as to continue our learning mission, which is what our goal was. We decided to reopen for in-person learning. We planned for it, and we delivered in a most successful way. There were 16 total positive cases detected by our Broad Institute PCR test out of 16,000 tests conducted on campus. So I'm talking strictly about the tests that we conducted on campus and the results of those tests on campus. That mechanism served us well, and we had great compliance from our students, our faculty, our staff, everybody participating in this wonderful program, science-driven, data-driven, evidence-based approach to mitigating the virus. We have found no viral spread within classroom and no faculty infection on campus throughout the semester. We're learning from other institutions that seems to be the rule. Other campuses are also reporting no classroom spread, which is what you would hope when you're observing social distance, wearing your mask consistently, and focused on what you're supposed to be focused on, which is learning together in a community, which is what our faculty and our students did this year in our classes in the fall. Our positivity rate, and we all are now unfortunately way too fluent in what that means as a nation. Our positivity rate remained below 1% and well below the surrounding communities. This chart here captures Wagner's 7-day positivity rate over the course of the 80 days of the semester in comparison with the blue line of Staten Island's 7-day positivity rate. And you can see we were always well below. When it trended up a little bit in Staten Island, it trended up a little bit as folks were coming and circulating from Staten Island to our campus. The number remained very, very low overall. And so that's a very good outcome. It exceeded in a positive direction, in a good direction, our models. We did better than our models. So kudos to the Wagner community, and kudos to science, which governed our process, helped us understand what we were dealing with and how to deal with it. We were governed by that. and a great culture here on campus that led to this success. And I wanted to say a little bit about that. You know, our community demonstrated compassion, ingenuity, and responsibility to ensure that we will emerge stronger, and we did. Our students were exceptional. We had student ambassadors and champions. Basically, every student was a champion and an ambassador. Similarly, our faculty and staff, all working collaboratively for the greater good of the Wagner community and for the greater good of Staten Island and the greater good of the United States, because we contributed in a way that demonstrates, if you observe these protocols, and they're not that complicated, they're not that many rules, they're not that confusing, they're very simple. And we will do the same thing in the spring, rest assured. I know one of the questions we'll get to in a minute is, what's the spring going to look like? It's going to look like the fall. Okay, so we're going to be observing those basic, simple rules that are scientifically proven and now demonstrated successfully on our campus because of our collective effort here at Wagner College. Very proud of our Wagner community. There's some other things we should take a moment and brag about. Again, this is something that is not necessarily in the Wagner DNA. We tend to be very humble, but you know, there's things we did that we should be really proud of. We had the top-notch testing protocol, the one that was developed at MIT and Harvard. It served 108 colleges, leading colleges, universities, all doing a great job. We are among them. We're very proud to be a partner with the Broad Institute. It served us well. We had to make that decision. We had to do that discernment on our own. Nobody told us to do that. Nobody guided us to do that. We determined that that was the vehicle that we needed to use, and we grabbed it in July and we used it, and we're going to use it again this spring. Again, looking ahead to the spring, yes, it's going to be a lot like the fall. We'll be using that road test. You can count on it. Take it to the bank. Transparent data sharing was a signature feature of our program. There's a group of faculty that are evaluating. These are not our faculty. These are scientists at other institutions, at leading institutions, and they evaluate how campuses do in terms of being honest, transparent, and reporting their data. And they looked at they don't have any vested interest in Wagner. And they said we got an A+. We were the top 2 or 3 in the whole country in terms of how we shared our data in real time. Sharing data is really good. You got to be able to interpret the data. And in order to do that, we formed in the summer, and it worked. And we actually met this morning again, a health analytics team. I think we met every single week, and we looked at our data. And we had an unbelievable panel of people together, senior administrators that you're going to meet today, as well as leading healthcare professionals from our 2 major hospitals here in Staten Island, chief of medicine, for example, at Richmond University Medical Center. Dr. Otterbeck was an exceptional partner for us. The deputy borough president. In New York, the boroughs have presidents. We have a mayor of all the boroughs, and then you have a president of Staten Island. His deputy, Ed Burke, was on this team. So we were in direct, constant contact with the borough, learning what the Department of Health was doing, sharing resources. We had partners from the 2 other educational institutions. Wagner convened this group. We wanted to be a leader. We wanted to share best practices. And so we cultivated this group and worked with our partners on this. And this was an exceptionally useful team that helped us calibrate appropriately as situation changed. That earlier chart showed that the data indicated that it was going up in Staten Island. This team would look at that data and they'd say, okay, here's a chance for us to adjust somewhat a little bit. We stayed open the whole time. We kept having classes. We kept having performances. We kept having practices. And they said, but you might want to change this one thing. And so we changed that one thing. And that was a very well calibrated, scientifically driven approach using the best minds that we could pull together on Staten Island. So will we do that again this spring? Yes, we'll do that again this spring. You can count on it. So you can see some of the answers to some of your questions are implicit in what I'm saying, but I'll just come back to the main point that I want to make here. And it's really about the Wagner community itself. And, it really is, you can have science, you can have transparency, you can have that dashboard, you can have the best minds of Staten Island. But what really counts is the performance of your community. If your community shows up, as ours did, you can be successful. If your community balks or you have people who won't participate, that will undermine the effort. That doesn't characterize Wagner College. Wagner College is a college where everybody shows up, everybody cares about each other, and that was a key for our success. And so all of those things together, And you know what? That's going to continue in the spring too. So we can count on it. We know our Wagner community. It was like that before the pandemic. It will be like that after the pandemic. We will emerge stronger and better and kinder because we have a wonderful community. And so I'm very proud. We're going to come through this very well. We've got a rough winter to get through as a nation, and then we're going to have a really good spring together as a community here at Wagner College. So with that, I'll turn it over to Vice President Ruta Shaw Gordon, who will be our MC. She'll be asking questions to our distinguished panel, as well as answering them as a member of that distinguished panel. So Dr. Shaw Gordon, thank you.
Thank you, President Martin. Before we start, I just wanted to express my gratitude as well. Gratitude to our students, to our staff and our faculty, and gratitude to all of you as parents and families for believing and working with us and encouraging your students to participate however made the most sense for your family. As a parent of a college student right now that didn't get to open, I think that it was gratifying to see how much our community came together, as President Martin was saying. So thank you to all of you, and thank you for joining us today, where we will hopefully answer some of your questions and then have more information as time goes on. So if you have questions, we've already received many questions, but if you have questions that you would like to have answered during this conversation, please use the Q&A chat feature, and then we will go ahead and answer the ones that are most relevant to the most people. If there are specific questions, we'll get back to you one-on-one with those answers so that we can ensure that we're addressing everyone's concerns and or questions. In addition, we are going to have another town hall in January once we are through the holidays and we have a sense of what's going on on Staten Island, in the country, and we'll have more information about vaccines and other things. So we'll talk with you again during that time to answer hopefully more detailed questions. So the first question, Dr. Martin already said, but I think it will be good to kind of go over again, is what is the spring gonna look like, Dr. Martin, and will it be similar to the fall?
And please join me, Ruta, if you would. Absolutely. I think it's going to look a lot like the fall, and that's been our default approach. We understand that the vaccines are coming, and Godspeed to the vaccines, but they won't be here in time to provide complete coverage and saturation until probably the summer, to the best of our knowledge. And therefore, we're expecting and planning, and we'll be communicating that the same protocols that we observed in the fall so successfully as a community will be the ones that we will observe throughout the entirety of the semester. That's so I think it's pretty status quo in that regard overall, and I expect great success this spring. I expect especially conditionings improving throughout the semester, which is sort of the arc of the semester. That's our best estimate at this point based on models that we have. That will start more stringent and proactively so and prudent. And then we will grow together as a community to relax a little bit more, and we'll end with some celebrations toward the end of the semester. That's the arc that I'm projecting, that we're projecting right now. We will revisit this constantly, as we always do. We will be certainly revisiting it and reporting more specificity as we get it at those town halls in January. But that's the arc that we're looking at right now. Ruta, feel free to add to that.
No, I agree. And I think the next part of the question is, when is the semester going to start and what are classes going to look like? And so I was hoping that Provost Kraus could begin to answer some of those questions, because I think that's what's on students' minds and families' minds trying to plan.
Thank you, Rita. At this point, of course, we are planning to be back on campus February 8th, and we expect to be using similar modalities to what we used in the fall. But the only thing that's really certain in all this is uncertainty. Right now, we believe we will be back on February 8th. But of course, we do not know the direction of the virus. We don't know what the situation will be like in the city of New York at that point. We're exploring other possibilities in terms of perhaps opening up a little later, or perhaps starting February 8th online, and then perhaps moving on to the campus. All of this is still subject to where we'll be, sometime next month. Right now, the plan is February 8th with the same array of modalities that we offered in the fall, which, we're trying to manage the virus. The challenge, of course, is the virus doesn't want to be managed too well. But, we have a plan, and unfortunately, the plan is subject to change. And as those changes are decided upon, if they're decided upon, we'll certainly be back to everyone.
Great, thank you. And so I think it goes to say that if you're planning travel, to make sure that the tickets that you get are refundable if you're flying, or that they're flexible, because we do plan on February 8th, but we don't know what's happening. We've been told by Dr. Fauci and others that, there's still going to be a really dark time. And so we're going to have to see how that goes and what rules and regulations are put into place. So, I would just say that when you're planning your travel, just be as flexible as possible and make sure that your tickets are refundable, or at least you can change the time period on them. I think that will help folks move forward. Dr. Martin, the COVID vaccine is a topic on lots of people's minds right now, especially because Pfizer is having their open conversation today to get the emergency authorization. Does the college anticipate mandating that students receive the COVID vaccine once it becomes available?
So we'll be guided by the health professionals and health officials on that regard, and the state may indeed mandate it. We'll see where we are with that. We are mandating the flu vaccine, and that's for logical reasons. And we've had great participation in our own campus flu clinics during the fall. That's going to help the healthcare system. That's one reason we did that. We don't want to overtax the healthcare system during a surge of the virus. And so that was another way that Wagner contributed to public health, because we took that responsibility very seriously, as did our students. And so therefore, I will repeat that we will be requiring the flu vaccine for anyone who's going to be coming to work or attend classes at Wagner in person in the spring. The vaccine, obviously, as a society, we need everybody to get a hold of that and take it, to make it be effective. And I'm confident that people will do that, because this has been quite an ordeal, and this is the scientific answer to that ordeal. And I think you're going to see people lining up. I will be, as soon as they'll let me take it, I'll take it. I know there are many other people that need to take it before I do. I respect that. I want the healthcare professionals like my niece, who works in an ICU, to get that shot before I do, for you better believe it. So we're not making a determination about mandating the vaccine at this point.
Yeah, I think exactly. We're going to follow science, and we'll see what is doable at the time, and we'll play our part as a college to help make sure that everyone around us is safe. The next question is, will the college allow students coming from out of state to quarantine on campus this semester? And I think a lot of that question is for me. A lot of that will depend on what the policies are by the state. Unfortunately, last semester, decisions were made kind of quickly, and lots of states were added. Right now, New York is saying that everyone who's not from a contiguous state has to quarantine for 3 days. They'll have to take the COVID test before they come, has to be negative. They have to quarantine for 3 days and take another test. That's what they're saying right now. And so if it's something along those lines, we are going to try and allow students to quarantine on campus. If it's something longer than that or more involved, we're not sure that we'll be able to do that. So I think we're going to hopefully have a better answer for you in January when we know more about where we're at. But we are going to try to do our part, and we're going to make sure that we're in communication with all of you as soon as we know things, just as we did in the summer, so that you can plan. And we're going to try and work with you. So know that part. Will students continue to take weekly tests during the semester? Dr. Martin, do you want to start and I can add in?
Yeah, that's the plan. I mean, we did it throughout the fall, and we're certainly, like I said, we're aiming to do that in the spring, and we have already procured that supply.
Great, yeah, and we're going to continue to do what we did this semester too, that if we saw anything in a certain group or anything, we did some extra testing, all those types of things, trying to be conservative in our approach to make sure that we are addressing issues before they're really issues. I just want to remind people that you can submit your questions in the Q&A panel. I see some people are doing that, but just wanted to give a shout out for that again. What is the deadline for students to let the college know if they're coming to campus in person for the spring? So I'll answer that one as well. If you are coming to campus in the spring, we are going to ask that you let us know as soon as possible so that we can plan accordingly. We're doing, as you know, we're redoing housing selection sometime in January so that folks can be prepared to know where they're living. But obviously you can let us know right up until the time that you come, because things change for everyone and we understand that. But for our planning purposes, the sooner you can let us know that you're coming, the better we can plan. So that's the deadline, I guess. All right, the next question is, I'm going to ask Dr. Kraus. Will the classes of 2020 and 2021 have a graduation ceremony?
Well, last year, President Martin committed to a graduation ceremony for the class of 20. We do have commencement for the class of 2021 scheduled in May this year. Right now, the answer is we are looking at a variety of options for going forward with an event for both classes in the spring. What complicates that, of course, are the state limits on the number of individuals who can be in a public assembly. So that, of course, complicates what we're trying to do. We don't know what those rules will be like in May, although we do have to start making plans for commencement really in January. So we're looking at a variety of options for how to go forward with this. By mid-January, we plan to have some sort of decision as to what the nature of commencement for the class of 2020 and for the class of 2021 will look like this year. But at this point, we're still working on options and waiting to see what the direction of the virus and also what the state's guidelines are for later in the year.
Thank you, Dr. Kraus. I know it's hard to plan for the unknown, so I'm glad that we're working on a bunch of options. The next question will be for Mr. Ramo. What do we expect the athletics is going to look like in the spring? And do we expect athletes to come to campus early?
Okay, well, as was just said, planning for the unknown is a big part of what we're doing now. We are working with our conference, the Northeast Conference, and we are fully planning, much like we are planning for that February 8th open on campus. We're planning for all of our sports, actually, the spring and the fall sports, to have a spring season. They will be, in many cases, shortened seasons with limited travel. But we are fully planning for that now. But again, it is fluid. We will know more about that in January as we monitor the situation. Having said that, for the second part of the question, there might be one or two sports based on when their season begins to actually play that might be moving back 1 week early if all goes well, but it would be 1 week only. So it would be literally the 1st of February right there. But we don't know that for sure yet, and we will continue to monitor. So much like we're talking about with the academic calendar, the athletics calendar, we're planning for it, but it's very fluid and it will continue to be, and we'll know more in January.
Perfect, thank you.
Joel, you want to add to that?
I will note that we are competing right now with winter sport, right? I mean, we are out there playing basketball right now.
Teams are playing. The men played their first game on Tuesday, and will continue later this week, and the women's basketball team opens in about 10 days with conference play. So our winter basketball program is moving forward. They are living here on campus in pod-like setting.
Great, thank you. Will students need to submit a negative COVID test before they arrive to campus? The answer to that is yes. Just like we did in the fall, we will ask students to submit a negative COVID test before they arrive. I think that was really helpful to us because some folks who were asymptomatic and tested positive stayed home, and that helped us to not start with a surge right on campus. So we will be asking people to do that again. Obviously, we will work with folks knowing how far out. Last time we did 7 to 10 days. Right now, the governor is saying 3 days. So we'll have to see how some of that works. And then we'll let you know as we get more direction from the state of New York. But yes, people will have to take a COVID test before they come to campus. The next question is, and this can be for everyone on the call, all the panelists. What lessons did the college learn from fall 2020? Sorry, hold on a second. From fall 2020 campus health policies, how does the college anticipate adjusting its practices based on the experiences that we had this fall? So Dr. Martin, I'll have you start and other folks can join in.
I think we learned a lot. I mean, you know, we obviously had never done this before, and we didn't have a lot of data to work on. And so we relied on the best science we could find from the best institutions that provided it. And then we also remained open to continue learning during the semester. So we came out strong. We pre-tested. Some campuses didn't do that. We tested every week. Most campuses didn't do that. We had a great social contract that would have helped develop with meeting with 800,000 students, you know, ahead of time.
800,000.
You know, with every student group, and we had great community, and we improved our communication consistently, and we improved our policies regarding taking it to another level in terms of we always exceeded. I didn't want to say this ahead of time. I didn't want to overpromise, but we intended and we did exceed the CDC guidelines regarding testing, contact tracing, quarantine. I mean, we did the whole package. And so but we also kept learning. I think that's the key thing throughout the semester. And now we continue to learn. This morning we met and we reflected on the entire fall semester. We're also reaching out to other colleges and universities and doing research based on what we now have a lot of data as a sector of American society. We have a million data points, and we're aggressively seeking out research that helps us learn, you know, what worked, what didn't work. And the National Academy of Sciences just published 2 major publications about what worked and what didn't work. And we assessed our own results vis-a-vis that, and we found out we did a great job. I mean, I have to be honest with you regarding the testing protocol, regarding communications. You know, can we do better? Yeah, we'll do better. We're going to learn and do better. But we did really well. This little college on the hill. We're not a big juggernaut with medical schools and schools of public health and all these fancy labs like Illinois and all these other places. But we did a really good job. So will we continue to learn? Yes, we will. And we developed new tools. And maybe Rita wants to talk about that or someone else, but we've got, not only do we have the broad backbone testing protocol, we also now have some antigen tests that we're putting into use that have a different utility, if you will, in terms of managing the COVID virus. And we're still looking for new tools. So that's the way we do things here. We are a liberal arts education institution committed to constant learning, and then we put that into practice.
Yeah, absolutely. And I think the other thing that we're going to be doing in the beginning of January is meeting with all the different groups again of students to kind of get their take of what went well, what didn't go well, how could we improve. You know, I think one of the things that was really great was students took this seriously, and they did use our confidential report form, and we were able to hold people accountable, not only students, but faculty and staff, so that we made sure that our entire community was following the rules that we had put in place, and that we all were agreeing to these things. So we'll continue to do that so that we can learn from our students as well. And if you as parents have suggestions that you've seen from other schools, please do email me. We would love to take those into consideration, because I think we're always learning, as Dr. Martin said, and we're always trying to make it the balance of safety and having a true collegiate experience, and we want both. So we're working as hard as we can to be able to provide both of those things. All right, when will the college hold housing lottery for the spring? How will this work, given that the college doesn't know the total number of students coming back to campus? So part of what we have done is we've already done a survey of students and asked them to let us know if they think they're coming back to campus. So if your student has not filled that form out, please encourage them to do so. We will send another email. We sent an email to everyone who had applied last March or February. Prior to us closing, we sent it to everyone to see who would be interested in living on campus in the fall. And we've heard from quite a number of students. So I think we're close to 800 students that are planning on living on campus. And so we do have a good sense of numbers. We are going to continue to do some of the pieces that we've done this fall, which will mean that we're going to keep Guild offline so that we can use it for isolation and quarantine housing. We will continue to de-densify Harborview and Towers so that we can make sure that we have a good ratio for bathroom stalls. We will be assigning bathroom stalls again. So all of those types of things are going to stay similar, and you will be getting a lot more information probably right at the beginning of January about how the lottery is going to work. So hopefully that gives you a general overview, and you'll hear more from residential education. Okay. Okay, sorry, I'm just making sure I'm reading the right question. Who should we notify about whether our students are coming to campus in the spring? So I think that your students should be registered for classes, and that gives us one idea. And then there will be another piece that will come out from the provost office that they will be asking students if they're going to be remote or in person. And then again, if you haven't let residential education know that you're living on campus, they should do that. So those will be the ways that we will know if your student is coming to live on, coming to campus, either in person or to live on campus. Is the college considering adjusting graduation requirements of internships for seniors? I'm going to give that question to Dr. Kraus.
At this point, we are not making any final decisions. I'll be consulting with department chairs on that point. In the fall, we did make some adjustments where it was necessary, and we will continue to deal with this issue on a case-by-case basis in the spring.
Okay, thank you. Does the college expect students will be allowed to have parents or family help them move in? So I'm going to be honest, at this moment in time, I would say no. That may change, but I think what we did in the fall really worked for us because it limited the number of people that were coming into the residence halls, and it made sure that the people that were in the residence halls did have a negative COVID test. So unless there are extenuating circumstances of why someone needs to help, we have worked with folks on a one-to-one basis for those, and you should just let residential education know. We are going to ask, just like we did in the fall, that people limit the amount of stuff that they're bringing to campus, because I think that that helped with the move-out process and also assisted in, we didn't have to do it, thankfully. Fingers crossed that we had to send people home in the middle of the semester like some other schools did, but we want to be prepared for the worst, but plan for the best. So I don't think at this time we would be having folks be able to have parents help move it, unfortunately. Anything else that anybody wants to say at this moment? I have to reopen my questions. I'm sorry.
I'm happy to answer the other question. The follow-up question to the lottery was about the cheerleading team, and similar to our athletic team, our other athletic teams, the cheerleading team right now, we are assuming and we're planning for that you will be able to do cheerleading in the spring. In terms of cheering at sporting events, right now, the answer would be only at outdoor events that are held, not indoor. And that answers the second part, I hope, of your question, which, yeah, it was really more of a statement that the cheerleading team, unfortunately, isn't able to support our basketball team at this time. That's because both the city and state guidelines have a very limited number of people who can be in our gym during basketball games. And once you add up the two teams, the coaches, a number of observers and the referees, we're at our capacity. So unfortunately, the cheerleaders were not allowed to be part of the basketball season. But much like everything else, it's fluid, but we do hopefully anticipate the cheerleading team also being able to participate in the spring.
Great, thank you. Again, if you have questions, please put them into the Q&A. The next question is, will freshmen be living on the same floor as they did in the fall? Unfortunately, we don't know that right now. We will be doing it through the lottery, but people can request their roommates if they want, just like they were able to in the fall. So that is something that they should plan on doing when they fill out their form for residential education. The next question is about moving companies and or delivery from storage facilities. So we are not going to allow moving companies to come into our residence halls. If people need to have stuff dropped off, they can do so outside of the residence hall, and we can make an arrangement for that, or delivery from storage facilities, because we know that some of you had to put stuff in storage for this fall. So if it's not, we will allow those companies to come and deliver the stuff outside, and then our students will be the ones that will have to bring it up to their rooms. So hopefully that answers that question. And I think we're coming to a close of questions from our audience, but I wanted to give you a chance, Dr. Martin, to give us some final words.
Well, thank you. Again, this is a dialogue, so we appreciate your questions. They were very valuable. We tried to address as many as we could during this session, but we encourage you to continue to send them. That's part of our process. It helps us be better prepared the next time we meet. We will be holding town halls in January. We're committed to continue to keep you up to speed. I just want to close by saying that I've got enormous confidence in our capacity to figure out these challenges. We've done, you know, it's like the challenge we faced in the fall was epic. And I mean, it was just unbelievable. And we addressed it. And now it feels a little bit more, we still take this extraordinarily seriously. We're not abandoning any sense of caution whatsoever, but we have confidence based on our experience in the fall that it feels a little more incremental. Okay. So like, you know, we've had, you know, we had to work through, how do you have a marching band perform in a pandemic? We worked through it. Our faculty devised the technology to enable that to happen safely, and it happened. How do you have theater in a pandemic? Our faculty and our staff and our students devised how to do that safely. So I'm extremely, how do you teach in a hybrid environment when you haven't done that before? Our faculty did that marvelously. How do you mount a state-of-the-art testing system, you know, that anybody in New York or anywhere would be thrilled to have free testing on a weekly basis in a pandemic? We did that at Widener College. So I'm very, very confident that a lot of the things that we're uncertain about, everybody's been talking about uncertainty. Yeah, it's uncertain in some ways, yes. But I'm certain that we have the capacity to figure this out and to make it a really great, successful experience for our students, faculty, and staff, and change that ratio from we're managing the pandemic and trying to create a meaningful campus experience, which we did in a rare way that's remarkable and noteworthy. We're going to make it even better in the spring. Okay. One way we're going to do that is to continue to be guided by the science, continue to observe those protocols, continue to expect everybody to show up and do their part. And then we're going to really knock it out of the park. So that's my prediction for the spring. And I look forward to continuing this dialogue with you. In the meanwhile, happy Hanukkah, Merry Christmas, wonderful Kwanzaa, Happy New Year. I think we're all looking forward to a new year, and I look forward to seeing you in the next town hall in the year 2021, which I guarantee, I pray, is going to be a better year for all of us. Take care.